So if you're watching this video, it's probably because you suspect you have gum problems, whether it's gingivitis or periodontal gum disease. And we're going to talk a little bit about that, but let me give you a little bit of background. First of all, probably about 94% of all adults at some point actually have gingivitis. Gingivitis is inflammation of the gum tissue. Then we go to a more advanced form of gum disease. That's going to be called periodontitis. And if we look at individuals over 30 years of age, we're going to see, maybe roughly about 44% of those people developing periodontal gum disease. And in individuals over 65 years of age, you're looking at a number closer to roughly about 94% of them developing gum disease. So what is gum disease? Two things that I want you to pay attention to, and that is, number one, there is bone loss when you have periodontal gum disease. In other words, the bone that's holding the teeth is lost. That bone loss is permanent. We do not grow it back. At this point, we don't have a way of growing bone back. The second thing to understand and realize about periodontal gum disease, I tell all my patients there's no such thing as a cure. I'm not going to give you a pill. I'm not going to do a treatment where I say, hey, you're done. You don't have to worry about gum disease anymore. We can absolutely control it. And that's where our focus and emphasis is on controlling it. The reason I like to show this video is I feel that if you understand gum disease and you have this issue, you have this problem, you can better manage it. So let's dive into this and let's look at a section. First of all, when we look at the mouth or look at teeth, we are constantly building up bacteria. Bacteria is a normal part of our life. Bacteria is everywhere. And there's good bacteria and there's bad bacteria, but this is the reason we brush our teeth. We try to remove the plaque, the bacteria that builds up in the mouth. So what we're going to do, I'm going to describe to you the stages of periodontal gum disease. So we're going to look at a section of the mouth, and we're going to peel the gum tissue back. And like I said, you're forming bacteria that builds up on your teeth, and what you'll start noticing is effect on the gum tissue. Now, bear in mind that this is animation. It's very exaggerated because it's trying to make a point. Your gums do not have to look as bad as what this is going to show. So bacteria builds up in your mouth. You start seeing subtle changes in the gum tissue. You'll see the redness, inflammation. The gum tissue might start to bleed. It is absolutely never normal for your gum tissue to bleed. If it's bleeding, there's an issue. As you continue to build up bacteria, it will begin to calcify and turns into what we call tartar. Tartar then accumulates, supports more bacteria, more toxins that irritate the gum, irritate the bone, and you'll start seeing the recession of bone. Again, this bone loss is permanent and does not come back. Eventually, you will lose so much bone that you lose the teeth. That is the biggest cause of tooth loss in adults. Again, very exaggerated in the way it works. It looks here, it is presented here. So our next thing is, okay, well, what is a periodontal pocket? When you come into our office, we'll do an examination. We use an instrument, a ruler of sorts, that will actually measure the crevice depth around your teeth. Let's look at a normal area. We're going to look at this crevice. We're going to see how deep it is, and we're going to see what is it that we see in this crevice. Well, first of all, this will go in a normal individual only 2 to 3 millimeters in depth. That is normal. That's what we call a normal sulcus. The bone level will be completely up on the root of the tooth. The gum tissue sticks to the root of the tooth, sticks to the bone, and there is absolutely no bleeding at all. That's normal. Let's contrast that with a periodontal pocket. So we go in and we're going to see very different presentation of the gum tissue. First of all, the gum tissue will begin to separate from the tooth. This will get in beyond the 3 millimeters. Typically, we're going to see maybe 4 millimeters, 5 millimeters in depth, 6 millimeters as it advances more, and certainly a lot deeper. But the bone that was once up here has migrated down. At the depth of this crevice, you will accumulate more bacteria, more inflammation, and that inflammation will present itself as bleeding gums, perhaps. So let's look at side by side what normal is. Bone levels up here, bone levels down here where you lose them, depth of pocket, no pocket depth, bleeding, separation of the gum. And this will present very aggressively in some people and not quite as aggressive as others. So how do we treat this? Let's get into our treatment. Our first thing, and what we're trying to do, is control inflammation by controlling bacteria. That's what gum disease is all about. It's about the body's reaction to that bacterial accumulation around the teeth. So step number one, we might do a general cleaning in your mouth, but our next step is to identify all the areas that you have bone loss, all the areas that you have pocketing. So we measure 6 points in every tooth in your mouth. So we create a map that will show us exactly where those defects are, exactly where the problem areas are. Once we have the map, we divide your mouth into the upper arch, we divide it into the lower arch. If we have the upper arch, usually is where we start. We'll place anesthesia, and it's just local anesthesia, very simple procedure. But the reason we use anesthesia is that we want to use instruments to go down deep into the gum. We're not tearing the gum, we're not separating the gum tissue from the tooth at all. We're just going in there and cleaning the root surface, disinfecting the root surface the very best that we can, so that when you leave here, every single tooth in that arch, whether it's the upper or lower, will be completely clean, completely free, as best as we can of bacteria that's accumulated in your mouth. We'll be very thorough in our instructions for oral hygiene. And what you'll start to see is changes in that gum tissue, where the gum tissue begins to tighten and readapt itself to the teeth. That inflammation, that redness that you may have had in the gum tissue will go away. The bone that's already lost, like I said, is lost. I can't grow it back. But if we control the inflammation, we can control the progression of gum disease. Now, there's other things that we do. We'll talk about that at other times, but this is the start of controlling periodontal gum disease.